Hey everybody, Joel Palmer here. Going to talk to you a little bit about acute low back pain. So if you've visited my channel, I've got a lot of little rehab videos on there for self-help things to try to get you through some difficult times physically. I've got one video on there called Acute Low Back Pain Exercises. I've got another one on there called Simple Home Low Back Strengthening Exercises. There's another one on there that's great for people who sit at a desk all day called Exercises for Sedentary Workers. All really good choices. I realize sometimes when you are in acute pain, the difficult problem for a lot of people is a lot of the exercises are floor exercises, and getting up and down off the floor can be nearly impossible when you have acute low back pain, and I realize that. What I tell a lot of my clients and patients is that if your bed is firm enough, it's got to be firm enough, you can do many of, especially the acute low back pain exercises right on your bed, and it's because it's a lot higher, it's easier for you to get on and off. Another option is what I'm going to show you here today. Just some basic movements, simple movements to try and help loosen you up. When you have acute pain, low back pain, usually there is a lot of muscle spasm in the lumbosacral muscle complex, inflammation, possibly some swelling in there, and it makes it really hard to really move. And anybody who's ever had acute low back pain can tell you, it interrupts everything in life. So in the beginning, the early stages, we're just trying to do some very minor things. A, break the spasm. B, try to move some of the exudates or the inflammatory chemicals out of the area. Try to improve a little bit of the mobility so you can do things like just get out of bed without pain or get in and out of a chair without a struggle. And obviously we're trying to reduce your pain. So it's minimal activities in the beginning. And the hard thing for me to get across to a lot of people who are having acute low back pain is no matter what treatment you get, whether you see your primary care doctor, your physical therapist, your osteopath, your chiropractor, your personal trainer, your massage therapist, your acupuncturist, whoever you see, it still takes time for the damaged tissue to heal. A lot of the initial therapy is to reduce the acute level of symptoms that you have, but the tissue still has to heal, so you still have to be cautious, smart, and you got to be patient, unfortunately. You got to give it some time. A lot of times acute low back pain is going to lay you up for a good week or two. It's not uncommon. So without any further ado, I've talked enough. Let me just show you just a couple of simple things. These are just simple activities, very basic things you can do standing. So when you are in that acute low back pain position, if you can get up and stand, sometimes you might even have to hold on to the back of a kitchen chair. You can do that if you need a little extra support. But here's a couple things I do, and we're just doing, I really just had you do it instinctively. You can go for sets of 10 if you wish. If you can't do 10 reps of everything, don't sweat it. In the beginning, we're just trying to get some fluid to move, some muscles to release, maybe some joints to start to flex and glide properly, okay? So we're not trying to force anything. So here's a couple of simple exercises. First one, just the little shimmy shake, okay? And it's slow and controlled. You're just taking your hips, and we're gonna lean to one side, kick your hip out to the other, side to side. And maybe we'll just do 10 of these, right? Just 10. Now listen, when you're acute, your shimmy and shake might be pretty low key, right? That's all we're looking for. That's all we're looking for, just looking to get things moving, okay? After you do the hip shake, we're gonna do some gentle hip circles. So we're taking it now, almost like you're working a hula hoop, right? Just little circles, and you can do 10 in one direction, and then 10 the other direction. Okay, just like that. Come the other direction. Okay? When you're done with that, I like to do just some gentle side bends. Gentle. Hands here, low leverage, and all you're going to do is you're just going to go with whatever your body will allow you to do. We're just going to slide the right hand down towards the right knee, come back to the center, pause right there, go the other way. So what you don't want to do is we're not trying to whip through it. Okay, if you've got acute low back pain, quick herky-jerky movements are going to set you off, so don't do that. So go to the right, come back slowly. Now while I'm doing this, I'm keeping my core engaged, right? I'm not slouching. I'm standing as tall as I can, and I'm squeezing my butt here for support, okay? And we're just tipping to the right, pause in the middle, tip to the left, pause in the middle. Each way, and we'll do 10. So here's how I count them out. To the right, middle, left, middle, that's 1. Right, middle, left, middle, that's 2. Okay? Another one I like to do are trunk rotations. Rotation is the most complicated movement pattern for that lower back. Okay, so you've got to go slow and easy, slow and easy. You're probably not ready to go swing a golf club or a softball bat just yet. So what you want to do is go nice and easy. But here's what we do. I just, hands up high, okay? Hands up high, we're gonna rotate. And I actually allow my feet to pivot a little bit, okay? Allow the feet to pivot. Rotate one way, rotate the other. Rotate one way, rotate the other. Easy. So in the beginning, you might not have a lot, right? So in the beginning, your rotation might be pretty minimal, okay? But that's all you're looking to do. You're just looking to get things moving a little bit and start to break the spasm, okay? So rotations, again, this is how I would count them out. One way, then the other, that's 1. One way, the other, that's 2, okay? If you can do the next one in this position, I like to do some knee circles. Taking my hands to here, and then we're just circling with the knees. Believe it or not, it's a pretty decent little stretch for the lower back. Again, if you can't reach your knees, you could always hold the back of a chair and just get down in that little sort of semi-squat position and do it that way, okay? After that, we could do, and what I would do is, I would do 10 knee circles one way, 10 knee circles the other way, okay? After that, I like something called the shortstop. It's in one of my other videos, and what you're gonna do is kind of go in and out of that position. It's called the shortstop position because you look like a shortstop in baseball. It's kind of here, right? We don't have to go down low, we're not going far, okay? The key here is we're not rounding, we're sticking our butt out just a little bit and sliding our hands down. So the shortstop position, here's how you would rip it out. Start here with your hands in front of your thigh, and then all you're doing is sliding to your knees, coming back all the way up. When you come all the way up, lock it right out. So you're gonna, again, squeeze your butt, squeeze your quads all the way, right? Lock things in. We're not jamming anything, but we just want to get that squeeze, okay? That helps to sort of help reset that pelvis. So shortstop from the side would look like this. 1, 2, and lean on your thighs. If you can't get to your knees, again, you could do it with a chair in front of you, okay? And you're just leaning on the back of the chair, or your hands just stay on your thighs, and you're just bending the knees and coming up. Bending, coming up, okay? It really depends on what level you're at, okay? Bend, and come up, and I'm actually literally pushing here with my hands, right? Assisting my back. And there, right? If you've got a little more motion, you can get to your knees and come on up. You could do that one at a counter in the kitchen. You know, you can do it on the edge of your sink in your bathroom, right? Boom. And you can push. Use your hands a little bit. It's okay to cheat. When you're hurt, it's a whole different world. This is rehab, not exercise. They're two different things, okay? We're just trying to get you out of that acute phase so you can move on and start to progress and heal, okay? One other one I'm going to throw at you I like a lot. Again, it depends on your level. I'm going to go over that a little bit more in a second, but I like I like to call them crescent steps. Some people call them opening the gate. So what you do, they are basically a hip opener, and it works this way. You're standing. Again, if you have to use a chair or a wall, you can do that for support, and you would just 1, 2, 3. Now, when your back is acute, the knee may not come up so high. When you're strong, that knee can come up pretty high, right? When you're injured, it might be here. You look like the opening scene from Hey Hey with the Monkeys, right? Isn't that how they all walked across the, remember they did this whole thing, right? So Hey Hey with the Monkeys. So whatever you want to call it. I call them crescent steps, but in the beginning, when you're hurt, you might have to keep it low. Okay, and this is how we count it out. So that's 1 crescent step, 2, 3, 4. Go at whatever pace works for you. Okay? Go at whatever pace works for you. Now, here's the rules. Do what you can do. Keep it in your range of motion that works for you. Everybody's going to be different. And if any of the ones I just showed you are just too uncomfortable or too difficult for the stage you're in, skip it. Do the ones you can do, okay? Do the ones you can do. So if you can only do 2 or 3 of the ones I just showed you, so what? Who cares? Do the ones you can do. The nice thing about this little routine, you can do it multiple times a day. Multiple times a day, and you probably should do it multiple times a day, trying to break up, again, that spasm and get some fluid moving, get that inflammation to push on out of there, okay? So it's the beginning of your low back rehab, very basic, I'll give you that, but sometimes in the beginning, you gotta start at the very, very basic steps, okay? So here you go. Try that at home. If you're having a lot of acute low back pain and you can't get up and off the floor, and it's tough to get in and out of bed, this is a good substitute. It might help you to start breaking up that pattern and start to heal. So, hope you enjoyed the video. Do me a favor, give me a thumbs up, and I will see you later. Take care, everybody.